Hello and welcome to PhysioTV Classroom. I am Dr. Riya Gondhali, an Assistant Professor, Sancheti Institute for Orthopaedics and Rehabilitation, College of Physiotherapy. And today I'm going to talk about incentive spirometry. So let's get started with the session. The objectives for today's PhysioTV classroom is to understand what is incentive spirometry, what is the purpose, the indications and contraindications, what are the types, and the complications of using incentive spirometry. Let's start by understanding what is incentive spirometry. So incentive spirometry is a device which helps in activating the patient's inspiratory effort. Now, we have to keep it in mind that this inspiratory effort is a sub-maximal inspiratory effort, which is going to help the patient in improving the lung expansion. This inspiratory effort that the patient takes through the spirometry device is actually like mimicking a normal yawning response. This device gives the patient a visual cue as to how much effort the patient is able to put in so that it works as a feedback. Now let's come to understanding what are the indications of using spirometry, or to be precise, incentive spirometry. So we have to keep it in mind that the primary indication for the usage of incentive spirometry is treating the existing atelectasis. There can be it is used in the presence of pulmonary atelectasis. It can also be used as a preventive measure taken so as to prevent the development of atelectasis. It is also used in conditions that can predispose to atelectasis, such as upper abdominal surgeries, thoracic surgery, surgeries in patients with COPD. And lastly, it is also used in the presence of restrictive lung defect associated with quadriplegia or dysfunctional diaphragm. Understanding the contraindications is relatively, incentive spirometry is a pretty easy to use device, also with very minimal risk factors and very minimal contraindications. So just to enlist the contraindications, the patients who are uncooperative or the patients who are unable to understand or demonstrate the proper use of the device, and the patients that are unable to deep breathe effectively. Now coming to types of incentive spirometers. So first is the flow oriented. So what does this mean? It means that how much ever the patient is able to put in the efforts in inspiration, that much is so what do you mean by flow oriented incentive spirometers? Like you can see in this picture, there are 3 balls present in this device. And every time that the patient is going to take a sustained, slow, and deep breathe in, these balls are going to get lifted up and be suspended in the air. Okay, so you need to understand here that, see, the one ball is going to be equal to almost 300 cc's. The next ball is indicative of 600 cc's. Sorry. The first ball is indicative of 600 cc's. The second ball is indicated of 900 cc's. And the last ball is indicative of 1200 cc's. So it shows that how much ever the patient is able to put in the efforts, that many balls are going to be lifted up or be suspended in the air. And this will give the patient a feedback as to how much the effort is and if more effort needs to be put in. Coming to volume-oriented incentive spirometers. So in this, unlike the first one, it is majorly based on the volume of air that the patient is going to be able to inspire in. So if you can see here, the blue colored indicator is going to rise up when the patient takes a deep breathe in, which is slow, and sustain it. And this is going to indicate how much the patient's efforts are. And so with this, you can give the patient a target as to if, say, suppose the patient's volume is just 1000 mLs, and then you can set a target that, okay, the patient needs to be able to sustain the deep inspiration so as to achieve 1500. Now, coming to complications, as I've already said, there are not a lot of complications related to this device, but the patient may land up into hyperventilation if the technique that the person is using is not accurate, or if the patient is using the device more often or more frequently, and the number of repetitions are more than which are prescribed. Secondly, there might be a discomfort secondary to pain in a patient, especially, like we have seen the indications already, that it is usually given in patients post-surgically. And in those cases, we have to be sure that the pain is not elicited and there is not a lot of discomfort post using this device. Lastly is fatigue. So a lot of the times the patient is already going to have a little bit of respiratory muscle weakness, and there will be poor inspiratory effort. And in these kind of patients, if we are going to prescribe inspiratory flow device and say the repetitions or the sets that are prescribed are not adequate, the patient might land up into fatigue. These are the references for my topic today. Thank you. With this, I would also like to thank the Physio TV team, Dr. Parag Sancheti sir, Dr. Ashok Sham sir, Dr. Apurva Shimpi sir, to give this opportunity. Thank you.